Imagine your chemo treatment for your cancer is canceled because the hospital can't deliver it, doesn't even have access to what chemo drugs you were on.
And healthcare has come under attack on both sides of the border. Last month, a cyber attack affected 5,000 computers on the University of Vermont Medical Center's IT network. In June, a ransomware attack forced Toronto's Humber River Hospital to declare a code gray loss of essential services. More recently, a cyber attack on Newfoundland and Labrador's health network data center resulted in the cancellation of thousands of medical appointments. And just last week, Headwaters Healthcare Center in Orangeville, Ontario, announced its system had been breached.
If a hospital in Canada was bombed by a group, we would have a very forceful response to that. But we've had the digital equivalent of a bombing, and it is barely registering at the federal level.
In 2018, the National Cyber Threat Assessment identified ransomware as the most common form of malware used for extortion against Canadians.
Ransomware attacks have increased by 350% this year. We have never seen this swell of attacks across all sectors, but acutely targeting the areas that we feel it the most and causes the most pain, and healthcare being top of that list.
According to the 2020 threat assessment, cyber criminals have become more engaged in what's referred to as big game hunting, honing in on larger enterprises where prolonged disruptions to their networks can't and won't be tolerated, and they are willing to pay out heftier sums in order to restore their operations fast.
This is classic organized crime in the 21st century form. It uses technologies that we use for good every day, encryption, which are the things that we rely on to do our banking securely, to hurt us.
From ransom demands in the thousands to more extreme cases where multi-million-dollar demands are made. In 2019, a Canadian insurance company paid out $1.3 million to recover 20 servers and 1,000 workstations.
In a ransomware attack, people breach your network in order to compromise your data. Usually that means taking your data hostage, essentially encrypting your data, and then telling you if you provide a certain amount of money, then we will send you a key to decrypt your data.
The cash is often sent as cryptocurrency. Although not impossible to trace, security expert Christian Loypre says it is more challenging.
The anonymity of cryptocurrency is a major driver of ransomware, and the people who carry out these attacks tend to be located outside of jurisdictions where we can investigate and prosecute.
So it's not just in healthcare, though, Shallima, because we've seen the TTC hit. We saw Rideau Hall being hit. That just came out yesterday. What are the feds doing in response?
Well, there are a few different areas within government organizations that are involved in monitoring cybersecurity. So let's go through some of them. The Canadian Centre for Cybersecurity, they offer guidance and support to government, to critical infrastructure, and also to the private sector. There's also the RCMP and CSIS. Now, back in July, the government actually joined allies denouncing China for a massive hack on Microsoft Exchange servers, which actually put Canadian entities at risk. But there is still a lot of work to do. And that includes more Canadians reporting these crimes so that they can be tracked. In the meantime, I'll send it back to you.
Thank you, Shallima.